What is imagery rehearsal therapy for PTSD nightmares? Imagine waking up after a nightmare that feels so real it leaves you shaken for hours. For many with post-traumatic stress disorder, these nightmares happen frequently and can be very distressing. Imagery rehearsal therapy is a structured way to help reduce these nightmares and improve sleep quality. It is a type of cognitive behavioral therapy that focuses on changing the content of nightmares while you are awake. The goal is to lessen the emotional impact of these dreams and help you feel more in control of your sleep. The process of imagery rehearsal therapy involves 3 main steps. First is exposure. You recall and write down your nightmare in detail. This helps bring the dream into your conscious awareness and makes it easier to work with. The second step is rescripting. Here, you change the story of the nightmare. You might alter the ending, change the setting, or add a positive or empowering element to the dream. The idea is to create a new version of the nightmare that feels less frightening and more manageable. The final step is rehearsal. You mentally practice this new version of the dream repeatedly while awake, usually for about 10 to 20 minutes each day. This mental rehearsal helps reinforce the new imagery so that, during sleep, your brain is more likely to produce the less distressing version. Research shows that imagery rehearsal therapy can be effective in reducing the frequency and intensity of nightmares related to PTSD. Many people experience better sleep and a decrease in overall PTSD symptoms after completing the therapy. It is often delivered over several sessions with a trained mental health professional who guides you through each step. During therapy, you are encouraged to vividly imagine the new, less upsetting dream before going to sleep. This practice helps your brain adopt the new imagery and reduces the likelihood of the original nightmare recurring. It is important to remember that this therapy targets the dream content, not the traumatic memory itself. Some individuals may feel hesitant about changing a dream that reflects real trauma, but therapists clarify that the goal is to modify the dream's emotional impact, not erase the memory. Imagery rehearsal therapy is considered a first-line treatment for PTSD-related nightmares and is often recommended before medication options are considered. It can be used alone or alongside other therapies and medications, depending on each person's needs. If you are experiencing frequent nightmares that interfere with your sleep and daily life, talking to a qualified mental health professional trained in this therapy can be very helpful. They can guide you through the process safely and effectively. Remember, everyone's experience with PTSD is different, and what works for one person may not work for another. Seeking personalized advice from a healthcare provider is always the best step toward managing nightmares and improving your overall well-being.